Welcome to Prep and Play, where we have conversations about safer sexual pleasure. This podcast is dedicated to empowering listeners through open, honest discussions surrounding keeping our minds, bodies, and spirits healthy while being sexually active. My name is Danielle, and I'm the Rural Outreach Specialist at AIDS Alabama South. And today I have with me...
My name is Rachel Carter, and I am the nurse practitioner and director of clinic services at Shell Health Clinic.
And today we're going to be talking about PEP, which stands for Post-Exposure Prophylaxis, as well as Doxy PEP, which is a specific type of PEP. So we're going to talk about how those can be used to prevent HIV infection as well as STI infection. We're going to talk about some different types of PEP, their efficacy. We're going to talk a little bit about a 2-1-1 regimen, which is technically PrEP, but we're going to throw it in this episode anyway. And we'll talk about Doxy PEP. So, Rachel, what is PEP?
PEP is post-exposure prophylaxis. So this is a regimen that we recommend individuals taking up to 72 hours after a possible exposure. And it doesn't necessarily have to be a sexual exposure. This can be out in the environment, anything in general that we want them to come in and get started on this regimen to hopefully prevent them from getting HIV if they were exposed to it.
Yeah, and so me and Caitlin talked a little bit about PrEP, which is pre-exposure prophylaxis, on our last episode. And we like to say that PrEP is like birth control for HIV prevention. If you take the pill every day when you come into contact with something that could give you HIV, you don't get HIV. With PEP, it's kind of like the morning after pill for HIV prevention. And so Rachel mentioned starting PEP within 72 hours after a possible exposure, whether that's a sexual exposure or like an accidental needle stick, something like that. Why is it 72 hours? What happens if not?
So it's just shown that if it's taken within 72 hours that it can be more effective. Now, if somebody was to come in to be seen and they are outside that window by a little bit, that does not mean that I am not going to go ahead and get them started, because I would rather get them started than not and hope for the best.
So what does a PEP regimen look like?
So a PEP regimen, for example, if somebody was to come in and they said they had, they went out 2 nights prior, they were partying, went home, and the condom broke. They're unsure of what that partner's status possibly is. So for that person in general, say this person was born female, first thing we're going to do is a rapid HIV test. And then we're going to also ask them about any previous STIs that they may have had in the past, and then also do a pregnancy test on them. If all of this comes back negative, what we're going to do then is get them started on just the general PEP regimen. So that's going to be a 28-day course of taking, we'll say Tivicay, which is an HIV treatment medication, and then Truvada, which is the PrEP medication. And they take both of those for 28 days.
Awesome. And I'm hearing that there may be a new option available. So instead of taking those 2 medications, Biktarvy has recently been approved for PEP. So now people could take 1 pill a day. And one of the advantages of that is our clinic usually gets samples of Biktarvy, correct?
That's correct.
And you had mentioned that outside of that 72-hour window, the efficacy goes down. How effective is PEP at preventing HIV?
Extremely effective. And just like you were saying at the beginning, comparing that to a Plan B pill, I'd like to say it's just as effective as that would be, as long as it's taken in those same 72 hours to make sure that effectiveness is still very strong.
Yeah, and so, that success rate does drop as people get further away from that 72-hour window. So I did want to talk a little bit about a 2-1-1 regimen. We usually do consider that in regards to PrEP. Could you explain to me what 2-1-1 is?
So 2-1-1 is going to be taking 2 pills immediately, and then 1 the following day and 1 the following day after that. So it can work really well, especially I would say in more of like an environmental exposure setting. It can also work for either sexual assault or post-exposure as a sexual setting also, but it's just not always recommended as the regimen of choice.
So when I typically think of 211, the way it was explained to me is taking two pills. Like if I know I'm going to have a sexual encounter, I don't like taking pills every day, but I know I'm going to get some tonight. I can take two pills the day of, like before the sexual encounter. I think it's up to two or as few as 2 hours before. And then I take one pill 24 hours after that, and then one pill 48 hours after that. Yes. And that gives me decent protection against HIV. So one of the reasons we don't recommend that is because there's a high degree of user error there. The one thing about taking a pill every day, when you take it every day, you remember it. It's a routine. And if I have surprise sex and I'm taking something every day, I'm protected and I know I'm protected. But having surprise sex with a 2-1-1 regimen is a lot more risky there, because if I don't know at least 2 hours in advance, how am I going to take my PrEP and be protected beforehand?
Right. And that's also kind of why I refer to it as saying like taking the two pills immediately, because some people, when they think of 2-1-1, they may not plan the sex. Obviously, sex just happens. So that's why I always say, as soon as you can, think of it, take the two pills, and then continue the next day with the regular regimen of one.
That makes sense. So we don't recommend this for high risk right. exposures at all. And then could you explain to me what Doxy PEP is? This is newer to me.
Yes. So Doxy PEP is using the antibiotic. It's regularly prescribed, doxycycline. This is a antibiotic that is used for a number of different bacterial infections. And so Doxy PEP is used as a way to hopefully prevent individuals from getting and spreading various bacterial STI infections.
And so is this going to be the same like 28-day course, or what does Doxy PEP regimen look like?
So Doxy PEP is more of not something that we would want people taking every single day for 28 days unless there was a known exposure. But again, that's not going to be Doxy PEP. So the preventative form of doing Doxy PEP is going to be taking 200 milligrams of the doxycycline within 72 hours of whenever the interaction occurred.
So that's just one single dose?
One single dose.
Oh, wow.
Yes.
And so what can Doxy PEP prevent?
This is going to prevent if there was an exposure to chlamydia as well as syphilis.
So does it prevent gonorrhea as well?
It may not completely prevent gonorrhea, but the infection course of it being a higher risk of getting gonorrhea, it does lower those chances.
Okay, interesting there. Why is that?
I think it's just because when somebody is having a coexisting infection with chlamydia, they're more at risk for getting gonorrhea. So by preventing the chlamydia, we're also preventing the risk of gonorrhea. But Doxy is not a treatment regimen for gonorrhea. That's why whenever I see that listed under Doxy PEP, I'm always like,
Oh, wow. That's interesting. I learned something new today. So how effective is Doxy PEP at reducing the risk of chlamydia and syphilis specifically?
So Doxy PEP is roughly new. So a lot of the statistics are still coming in as being new. But when it was in the trial, it was shown to greatly reduce the risk of getting any of those bacterial STIs.
Awesome. And so although it does greatly reduce risk, we don't recommend this as a substitute for regular STI testing or preventative methods like condoms. Are there any possible side effects both to PEP and to Doxy PEP?
There are a number of side effects, but the benefits definitely outweigh those risks in terms of side effects. Now, I tell everybody when they come in for a post-exposure, one of the most common complaints that I hear is nausea or vomiting, diarrhea, something like that. So if that is something that does come up, I am always readily available to give out some anti-nausea medication or switch-up regimens as needed, because I have seen cases that people stop their PEP regimen due to GI or stomach issues, and they have in turn the PEP did not work. And so they are now living with HIV. And so for those reasons, like, I am constantly like just putting it out there. Please tell me if you're having side effects. Please tell me if you're not tolerating this medicine, because it does work when it is taken, and I can help ways around those side effects.
That makes a lot of sense. So just practical considerations here. How can somebody obtain PEP and Doxy PEP?
Well, coming to Shell Health, that is one way. I know there are a few places online that people can, if you do a search, you can kind of search for a Doxy PEP provider if you're out of this area and you can't get here, of course. There's a number of different ways. Various health departments, a lot of public health agencies will offer the Doxy PEP. I'm not going to necessarily say that it's free or low cost at other organizations. Urgent cares also, sometimes depending on the providers, will provide that as well.
Awesome. And so as far as cost goes, what does the cost and insurance coverage usually look like for PEP and Doxy PEP?
PEP can be very expensive. So private insurances sometimes will cover the PEP medication or cover majority of the cost with a copay. In terms of the Doxy PEP, a lot of insurances will cover doxycycline, and it is not one of the expensive antibiotics, so it can also be a lower cost option. However, at Shell Health, we do offer copay assistance programs and patient assistance for those that do not have insurance or have higher copays.
Awesome. So we talked about the different types of PEP, including PEP for HIV prevention, that 28-day regimen, and 211 PrEP, which is 2 pills immediately before or following sexual activity, 1 pill 24 hours after, and another dose after that. We talked about Doxy PEP, which is prevention for bacterial infections, and we talked about how to obtain those things. I just want to reiterate how important it is to speak to your healthcare provider so that you can get on PEP or Doxy PEP within 72 hours after exposure. That window of efficacy is super important there. If you are in need of PEP or Doxy PEP, you're welcome to visit us at Shell Health, the on-site clinic here at AIDS Alabama South at 4321 Downtown or Loop North in Mobile. If you're outside of the Mobile area, you can look up your local health department or urgent care, or just Google PEP services near me. Thank you, Rachel, for joining us today. And
you're welcome.
On our next episode, we will be discussing sexual health conversations to have before having sex.